The great thing when we're talking about the treatment options that are available for depression and anxiety, both during pregnancy and during that postpartum period, is that there's a really wide range of treatments that are effective, and there's many treatments that are effective. So what this means is that women and fathers and their providers can choose the treatment that's going to work best for an individual. So these include different kinds of psychotherapy. So both cognitive behavioral therapy and interpersonal psychotherapy are both effective for treating both depression and anxiety. So this is true in the general population, but it's also been specifically shown during pregnancy and the postpartum period. There's also pharmacological treatments, so antidepressant medication. Some women express concerns about taking these medications during pregnancy, or especially if they're breastfeeding. So it's important to have a conversation with your doctor about balancing the risks and benefits. But one of the things that's important to consider is thinking about the risks and benefits not only of the medication, but also the risks and benefits of depression and anxiety. So we know that depression and anxiety during pregnancy and also when a baby is young is also not good for child development or for fetal development. So it's important to consider what the risks and benefits of using medication are, but also what the risks and benefits of not getting effective treatment are. There's been increasing interest in complementary and alternative therapies. So one example is yoga, and we have found that yoga can be effective both for treating and preventing depression during pregnancy and the postpartum period. So one of the interesting things is that yoga seems to combine two different elements of treatments that we found to be effective in other contexts. We know that exercise can be beneficial for mood. So there's the physical activity component, but there's also what we call a mindfulness component, where we're changing how people relate to their thoughts. And another really exciting development in research has been thinking about the ways that technology might be used to improve access to this care. So we have effective treatments, especially our psychotherapy treatments. We know that they are effective. We know that they can help with depression and anxiety. And not only do they help with treating depression and anxiety, but they can be helpful for preventive interventions. So being able to use technology and being able to use things like the internet, social media, and even smartphones to help disseminate these treatments can really help improve access, especially for women who might be at home with an infant and it might really be hard to get in to see a doctor on a regular basis for something like therapy. So that's a really exciting development that I think is really going to improve access to care and the number of women who are able to benefit from these treatments.